All right, give everybody a minute here. It's 10 a.m. Jay Mervis from Fortinet. I've got Pete Metzgar with me here today. We'll give everybody a minute to log in, and then we'll kick off the show. We'll give it another minute, Pete, and then we'll get cooking.
Sounds great.
All right, we'll get rolling here. Hey, so good morning and welcome to the first webinar here for the Hammerdown Roadshow powered by Fortinet. My name is Jay Mervis, and we are going to put the hammer down and talk trends, tech, and tunes. I'm the healthcare sales director for the East here at Fortinet. Everyone always asks, how do you know so much about virtual care? So I thought I would bring my source onto the first webinar since we're talking to customers about the increased adoption of virtual care and how they are delivering and supporting that technology. Many customers are enhancing or reevaluating since there was a rapid adoption at the beginning of the pandemic. So today I'm here with Pete Metzgar. He's also a good friend of mine. He's in my concert crew. I think I've seen everybody in a while. So when we're going to talk trends, tech, and tunes and put the hammer down, Pete, why don't you give us a little background about yourself and Caregility as a firm?
Yeah, Jay, thanks for having me on today. I really appreciate it. For everybody joining, I'm Pete Metzgar. I work for Caregility. We're a company based out of Eatontown, New Jersey. We have a customer center in Charlotte, North Carolina here. I've been in healthcare about 11 years. I started out in the computer carts, medication cart delivery business until about 2015, and been working in telehealth ever since. So the adoption moving forward of seeing where telehealth has come pre-pandemic to the pandemic to hopefully post-pandemic has been an amazing journey. But Jay, thanks for having me on today. I really appreciate it.
Yeah, no problem. Anybody that's attending the webinar, if you got any questions, feel free to throw them in the chat. We'll respond to them. Hopefully nobody has to too tough of a question of us. And, we will look like two kids that stole some candy from the candy store. So, hey, so let's talk about the trend, Pete. Virtual care, the three pillars of virtual care: telemed, telehealth, remote patient monitoring. Most customers are at some different stage of the journey, scramble to adopt, sophisticated adoption, and that's forced some significant security platform consolidation. Pete, can you talk a little bit about Caregility and what you guys are doing within the virtual care market and what you're seeing from a growth perspective?
Yeah, sure. I mean, it's great questions, right? I mean, real good topics of mine today. Caregility is dedicated to really connecting patients wherever the patient is. We're doing that through our Caregility Cloud, virtual care platform. We were recently, you see my wonderful marketing and advertisement in the background, as you mentioned earlier on, best in class for 2021 and 2022. And, that's one of the things that we're happy about with that is that's voted upon by our customers. So the experience that they're getting of, working with Caregility, how our devices that are purpose-built, ecosystem and telehealth endpoints, if you will, across that care continuum through multiple use cases. Some of the stuff that we're running into is just, when we have these conversations with the health systems is one clinical communications platform for healthcare. How can we plug in multiple use cases and multiple workflows into one platform that we can just build on a physician experience, clinician experience, and also a patient experience? So think about TeleICU, your high acuity, if you will, from that perspective. Stroke is another big one, behavioral health, But some of the big trends that, we're seeing right now: virtual nursing, virtual patient observation, patient room of the future. You mentioned remote patient monitoring in hospital home, and that's where we're seeing a growth perspective. And, virtual visits being huge during the pandemic, it really connects to what our mantra is as Caregility, of connecting to where the patient is. So the one new one that we're starting to see here in Charlotte locally, but across up in New York City and some other places, is a program called ET3, which is actually having emergency services. To think of a medic or an ambulance coming to your house for some sort of event that's taking place, but really preventing a transfer to the ED, and can a telehealth visit take place in the field. That's been an exciting one, to see. So, hey, Jay, I was going to ask you, what type of these, trends are you seeing, in your space as well, in regards to Fortinet?
Yeah. So when we talk to customers, Pete, the virtual care is one of the 4 pillars we talk about. So it's whether it's cloud adoption, connected medical devices, system expansion, but, virtual care, telehealth, telemed, remote patient monitoring. The one feedback that we get from customers is the expanding attack surface, right? It's driven by care being given inside and outside the walls of a hospital. So, we joke all the time that, it's not your father's Oldsmobile, right? So, if your grandparents or parents, their physician passed, they quit going to the doctor, right? And so there's much more flexibility in society now with the Amazonification, I guess, of the world. So, most customers are, the feedback we've been getting is we would like to have 5 or 6 key partners that we can leverage, 90% of that technology to, aggregate threat intelligence, as well as enable those services, and then the resource constraints, right, which we'll touch on later. But what,
Sure.
it is interesting because everybody's trying to go to this platform approach because of the resource constraints. And you talk about virtual nursing is now, rising up in the virtual care world, which, we always talk shop on the phone. What did you talk to Pete about? I don't know. We just talk shop, right? And, virtual nursing is expanding. But what do you, when Caregility engages with a customer, Pete, like when we engage with a customer, like, if we sell 2, 3, 5, 23 products to a customer, we try to target, 90% adoption versus having 20% across the board moving on to the next project. How do you guys define success criteria when you're working with a customer? What does that look like?
Yeah, I mean, we want, from a Caregility perspective, the technology to fade in the background. So think about providers, caregivers, clinicians, anybody who's going to be using on the hospital side. We want it to be a driven use case, right? So we're tying in our clinical team. So we have a senior vice president of a clinical program management team at Caregility that helps work with the hospitals to drive workflows. What are we trying to achieve? What is the patient experience? What is the clinician experience? And from that standpoint, what are we trying to solve? But also working with the technical teams to make sure that we have those defined outcomes. We want to make sure that that technology works every time, whether it's an inpatient scenario or an outpatient scenario, to make that connection. Again, going back to what our mindset is at Caregility, connecting everywhere the patient is. So using the technology, but we really are focused on the clinicians, that the technology is fading in the background. One of the other business drivers, part of a follow-on is, the remote patient monitoring in virtual visits of, to reduce the admissions, right? So we're seeing a lot for, teletherapy, behavioral health, group visits. We're getting a lot of stuff for like diabetes education, telerehab. So some really cool use cases that are taking place where, these patients don't have to come back into the hospital, and using that, a therapist who's, at the facility or an ED or clinic, being able to work with the patients in their environment at home, from that standpoint. So some pretty fun stuff that we're really getting into right now.
Yeah. So Pete, when you talk to the executives there, part of all the decisions made in healthcare are based on either patient satisfaction or employee satisfaction. You've got some long-term 3- and 4-year customers. Did they come back to you and said, age cap scores have increased, our Press Ganey scores have increased? Is this helping, those facilities build their brand out better?
Yeah, absolutely. 100%. It's helping them build out their brand better. We're getting asked to do more webinars and white papers. We recently were just asked to do an IBR study, which is driven by clinicians, and talking about first and best use cases of being able to have clinicians, really writing all the documentations and the success criteria and sharing that with multiple others, that want to know how did they do it? How did they get their patients to raise those scores? Part of it is, and we see this every day, it's Yelp, it's Google, any service that you're getting today. Hey, please rate me, please provide that feedback. Employees do it on Glassdoor, if you will, for their company and stuff. But, doctors in these health systems are starting to look at, how their doctors are rated. My wife had a minor surgery this week, and she, was Googling the doctor. Did he go to Duke? Did he go to Carolina? What is his credentials? How long has he done? I mean, it's comical in regards to how the world reacts, but we all are a little bit research driven in regards to who's operating on me, who am I seeing? What is their background? Do they know what they're doing? So, some of those things that we're running into is really driven in that regard.
Right. And we get a ton of feedback on that too, Pete. When we're talking we overlay the local sales teams and we talk to those customers like, hey, what's the business problem, right? So part of it is like,
Right.
how do we enable services? Patient portal scheduling has been a big headache, things like that. So how do we go and make things faster from some of the things we do with our web application firewall or SD-WAN or just connecting multiple clouds? But yeah, I mean, delivering those services to the end customer. So it's a perfect time to transition over to some tech specific things, Pete. So
Sure.
we talk about, we've got a mutual client of ours, but when we were both younger calling on them, they used to say, hey, we're here to improve patient care without changing bedpans, right? And that's literally, some of the mentality. How do we improve patient care? What's our mission every day? Give more than you're getting out of it so that the market gets better, right? So from a Caregility perspective, how do we leverage that technology to improve patient care, right?
Yeah, I mean, going back, there has been so many disparate technologies that health systems have been using. They're using them. They were really singular focused. Early days are focused on tele-ICU, or they're focused on stroke, some of those high drivers, right? But now what they're seeing is certain technologies don't really work across the care continuum within the health system. So take, for instance, virtual visits, right? You got Android devices out there, you got iPhones out there, you got tablets out there, you got just the multitude of different things, right? And all a health system wants to do is say, I just want to use this one experience so that my providers or my caregivers that are using it, doesn't matter if they're calling a hospital room or they're calling a patient home, that the user experience from the clinician side is the same, functionalities, features, that sort of thing. On the patient side, I'll take my father as a 70-year-old man. He doesn't want to download another app. He could care less about apps. Now, he has a cell phone to look up the sports scores and things like that on his Android stuff, but he's not on Facebook and doing all this other stuff. So if he wants to see his doctor, he's old school, call me on the telephone, but he did do his own first virtual visit. He goes, all I had to do, Pete, was click the button. It was great. So I used my father, a military vet, 72 years old, as like the guy who's going to test out. Are we clicking too much? Are we doing too much? So that experience, right, from a technology stuff. Some of the other stuff, like, from a platform standpoint, virtual visits, and I'm talking pandemic. But now you're starting to see, more about, all right, patients in the hospital. What are we using there? One of the big drivers that we're getting into is virtual patient observations. So we have a module called iObserver. So it uses technology that's in a room. It could be a cart, could be a wall system that's on the wall, basically to have caregivers keep an eye on patients from a patient safety standpoint, to make sure they're not pulling out Foley's or they're getting out of bed for fall risk. Basically have the visual of 12 patients on a screen. Gives them the ability to talk, listen, alert if something's happened. We're seeing a drastic amount of success criteria driven at hospitals by just being able to use the technology to watch patients. It's an amazing thing that we're seeing right now. The last
So,
one, that's big for, go ahead. No,
no,
yeah,
that's awesome, because we were talking about this maybe 6, 7
yeah,
years ago, right? Like, how do we take a force
right,
multiplier technology instead of paying 24 hours a day to observe patients, use some artificial intelligence, do some gait
right,
analysis, things like that, to say, we don't need somebody reading a book, paying them, $15 an hour to
yes,
observe somebody for 24 hours a day. Like, hey,
right.
all of these things come into the technology. That's awesome that you guys are doing that, Pete.
Yeah, I mean, it's a big one that's we're seeing a lot of right now. But patients are going to be in the hospital. How do we keep them safe? How do we use that technology? And I say we mean partnering with the health system. The other one is using our iConsult platform, and when you pair up our Caregility iConsult platform with the likes of Parahealth or a Philips eCare Manager or an Epic, a clinical technology that's really looking at algorithms of preventing a patient event to take place, right? And how can using the technology for somebody who's sitting in a virtual operations center or a clinical operations center to really dial into that room and assist the bedside staff to help them deliver care. That's where it really gets cool, is really seeing, that's when the partnership of technology and people is really coming together. Because at the end of the day, for all this, we want to keep patients safe. We want to prevent bad events from happening. And we want to make sure if we can take care of this patient while they're in the hospital, can we use technologies and have caregivers from anywhere connect into those hospitals? So, really cool stuff that we're doing. Hey, what's Fortinet doing, in some of those regards? I mean, I know I'm putting technology in, but obviously there's some drivers that you guys are looking at of everything coming in and out of the networks and things of that nature. But I'm just curious.
Yeah, I'll throw mine on. Then I think we had a question or two, Pete. So the expanding attack
Sure.
surface, right? Resource constraints and aligning to the new hybrid world of, in-person virtual care, work from home, all this stuff has exploded over the last couple of years. It's not going to be the same as it was before the pandemic, right? And we enable
Right.
those services through a variety of different products within the platform, right? SD-WAN, that enables services, our next-gen firewall, which protects. And then every customer is in some level of maturity on implementing zero trust to protect. So that's where we're seeing some of the stuff going on. Pete, I think we got a question here. How do we ensure PHI isn't more at risk with the Telemed solution? I don't know if you want to take that, or you want me to address it.
I can let you take your take, and I can give from a Caregility perspective if you want. I'll let you go first, Jay, if you want.
Yeah, sure. Well, so we use our next gen firewall with a strict access control list and IPS. Yeah, that's how we address a lot of protecting the PHI on the in the cloud and on-prem. So that's what we're doing. Pete, how do you guys do it within your platform?
Yeah, within our platform, I mean, Caregility is verified by a third-party service, so we're HIPAA compliant. We're working with ISO 27001 certification, which really looks at PHI. We're not storing anything or recording anything, so that kind of helps some of our cases. But with our cloud technology, we're saying that we are protecting PHI, but we've taken an extra step. We've done the ISO certification. We're being verified by a third-party company that says that they are doing these things. But there's a number of other things that we do when working with a health system that we go through a tech review board, to make sure what the stance of the health system is in regards to PHI, that it's being protected from there. So every health system is different, and we take that on a case-by-case basis.
Sure, and that's a perfect transition to something else we wanted to talk about, Pete, is if a customer is going on this virtual care journey or taking a more thoughtful approach to delivering care, what should they be evaluating within their environment so that when they call Caregility or they go deploy a solution, they hit the ground running?
Yeah, I mean, great question. I mean, I think network and security is the big thing. And, from a Caregility perspective, is the network set up to handle telehealth and virtual calls in and out of the health system? Think about bandwidth. Think about where the patient is, is there enough connectivity to take place, with that? So I think, that's a big thing we still run into.
Yeah. Do you guys have a checklist, Pete, when you're going through with a customer? Like, hey, what's your posture look like? What's your network look like? What do you run into when you provide that checklist? Is it always truthful?
Yeah, no, I mean, so we use a service that does a network test, and we look at all the puts and takes in regards to network. But every customer that comes on board, we have multiple checklists. So we look at clinically from a use case standpoint, technically, from a network and security standpoint, if it's integrated with a clinical technology, like an Epic or a Philips or a Para, is it connected securely, from that standpoint. We have advanced engineering group that we work with, as well as our product development team and our clinical team, as well as customer success, to really look at each one of those pillars of that use case within a hospital, but overall the ecosystem of the health system too. I think one of the cool things that we do, different than a lot of other of our competitors in the industry is we have dedicated clinicians that are helping people like me that sell technology, and I'm sure like you, Jay, like we're in this mode of, hey, we got this cool technology and it could do this thing, and yes, we're in the app orchard of this XYZ and we could do this, but the clinical staff that we have with us is always keeping us honest. Is this easy for a caregiver? Is this easy for a patient? In a real scenario, from that standpoint. So those are the fun, things that we get into.
Yeah. So what are the common pitfalls customers should be aware of when they're developing the strategy? Because before, like when this all started, people were cobbling things together and it worked. And
Right.
now with the resource constraints and wanting to do more like virtual nursing, like what do you see and what should customers be aware of before they go down this journey?
So amazingly, in 2022, we brought on a couple customers. We are still, in this first quarter of this year, we still are working with health systems that network segmentation is still a huge problem. So they still have the same type of connectivity within the health system that, my aunt is sitting in the lobby who's watching Netflix, and that's the same pipe that data is going down, and there's not really this dedication of VLANs, out for telehealth workflows, being able to run video through the network, if you will. Ignoring technical debt, a lot of the health systems are really proud of what they put in place 7-8 years ago, and as you see, and I've seen, this technology is changing so quickly with everything. With new competitors coming out with new ideas, which, I love competition. I think the tide rises all ship and it makes everybody better, which ultimately is going to help, our hospitals and health systems better. So I love it. I have a lot of friends at different competitors of ours, which is great. But that technical debt is, from a Caregility perspective, being consultative of what is best in class, what is purpose built for healthcare, what is the best for today that's going to get through, to connect to your patients, your stakeholders, if you will, everybody using it. And, cost effective is huge too. So, those are some of the things we still run into. But do you guys run into, some of this as you're going through? I mean,
So I mean, the VLAN, like it's, a lot of guest networks are public utilities. So some of the things that we're doing is in the segmentation products, using our next gen firewalls for, lab and some of these advanced services, SD-WAN to consume things. So, the zero trust that we were talking about before, there's a journey on that. Everybody doesn't back up a Fortinet truck, even though we'd love them to go and deliver those services. So, we're definitely seeing a lot of activity. There's customers that have stumbled into Fortinet because, we deal with medical device manufacturers. Some of them have strong IPS lists. And in major compromises, they haven't been breached. So why did you guys get breached? So that's some of the things we're doing on the segmentation side. So with labs and net new acquisitions, or with the technical debt you're talking about, one of my favorite topics is mergers and acquisitions. When customers go buy a different facility, it's sometimes they show up with ESPN classic technology. So So
hey, let me ask you.
Go ahead.
Let me ask you real quick. Talking about, somebody being, broken into or hacked or something from that standpoint, I'm curious, when a health system gets hacked by a technology, maybe it's older, maybe it's newer, maybe it, from that standpoint, what does that look like, inside a health system? I mean, obviously you guys, Fortinet's doing a couple things to kind of show that protection and how to do all that. But if the health system is getting hacked, what's that cost look like? I guess.
Good question, Pete. Every incident, that scales beyond just a simple incident, it's about $6.5 million. So, it's time is money,
Yeah.
reputation, brand, and impacting patient care, right? So we've seen some high level breaches where operational downtimes have been anywhere from 30 minutes to 3 months and in between, and patient death, right? Nobody wants to see that. So, well, let's kick it over to something a little more exciting. The third pillar of our webinar series in the Roadshow is tunes, right? So discuss a band and take a couple songs. Pete, since you're the guest, what band did you want to discuss today on the webinar?
Well, I have to, obviously, you and I shared a couple phone calls over the last couple weeks, and we know how music is very important to our social life, if you will. But I can't be remiss if we're going to talk about tunes is the Foo Fighters. Foo Fighters is one of my favorite bands in the world. Growing up as a 90s kid, 80s, 90s kid, and seeing the journey that a frontman like Dave Grohl took with Nirvana as a drummer, and seeing his friend, pass away. And then recently with, 25, 26 years of being in Foo Fighters, Dave Grohl losing another one of his best friends, Taylor Hawkins, drummer, just sad for the music industry, sad for what's going on, in my opinion. Our bands, and I'm sure our parents felt like this as they got older in the age, that all the good music is going away. But
Totally.
Foo Fighters to me is, Foo Fighters for me. Let's talk about it.
Let's talk Foo Fighters. So when we talk about virtual care and securing it and the opportunity with things being different now, Pete, what's the first song that ties back into what we're talking about with virtual care?
So there was a song that came out on one of their last records called "Sky is the Neighborhood." So I think about "Sky is the Neighborhood," and it's a great song. If you haven't listened to it, go down on Apple iTunes, on your Apple device, or wherever you get your music. But "Sky is the Neighborhood," think about pandemic and telehealth, right? Telehealth was a nice to have, thing. And, as I mentioned with the Caregility mantra of connecting care everywhere a patient is, I think about the sky as the neighborhood, right? Care today is completely different than it was 3 years ago, right?
Right.
2 years ago. We need to be able to help health systems deliver care where the patient is. Inpatient, outpatient, clinics, EDs, at schools, you name the use case, right? How can we bring those expertise, those family members, anybody that needs to be at the patient bedside, wherever the patient is, to take care of them. So I look at the sky as the neighborhood is that big conversation there. But I don't know, how about you?
I think Sky is the Neighborhood's a great one to start with, Pete. The possibilities are endless to connect everything up and deliver care for anything within the care continuum. Mine, I would say Everlong. I've been a fan of automation my whole career. Like the Rise of the Machines and the Terminator, but Everlong, I mean, I love that tune. I mean, we named the farm Everlong Flower Fields. The biggest line to me is "Hello, been waiting here for you." And Dave drums this one in the studio. So, I mean, it was an unbelievable tune, but I think the market's been waiting for this, like as a consumer for a long time, right? And you're seeing a lot of care go this direction. So.
Yeah, well, I mean, you mentioned the lyric, right? "Hello, I've waited here for you." I'm connecting that right back to virtual care and telehealth, right?
Well, yeah.
We've been waiting for this, right?
Right.
And, some of us who've been in the telehealth industry for a longer time, we've been waiting for telehealth to become healthcare, right? We've been waiting for that to take place. So, I think about the other lyric, of course, right? If everything could ever feel this real forever, if anything could ever be this good again, right? 2 years ago, different conversation. Today, we're in a different pattern of how we're delivering care. Why did it take so long to adopt telehealth? We're seeing that adoption rate really starting to perk up, which, you know, ties into the network and security, but also ties into health systems have changed their missions and their drivers to basically, we
Right.
need to reach our patients wherever they are. So it really ties into what you're doing, what I'm doing, and, you know, industry experts are talking about today.
Right. So let's kick it over
Hey,
to another one. Let's, like, every band, when they make it huge, they do a cover. So let's talk about,
yep.
I'll give you the cover, Pete. Who do you like?
All right. So let me share something real quick, right?
Oh,
And I'll share this
137
across the
slide
screen.
deck. Awesome.
Yes, another 100. You see the screen?
Yeah, you're good.
All right. So this is, if you think about this, we were in trouble because we went to the Foo Fighters concert together 2 years ago, or three, almost
Three now.
three now, right? Yeah, three now, on Mother's Day. So you could only imagine what Jay and I have got in trouble with our wives. But we will tell you that it was the best Mother's Day as we skated out midday to go see the Foo Fighters. So this is a picture from where Jay and I were. But, you know, I've always wanted to be in a band, Jay. So this
Me
is
too.
old school Pete Metzgar 20 some years ago. But here's me and you at the Foo Fighters, which we had an amazing. So at this concert, if I go back, right, during the concert, they sang Breakdown by Tom Petty.
Right. For like 15 minutes. I mean, they're like freelance.
It was
the whole thing
great.
was unbelievable.
Right? So if I connect that song back to telehealth, right? Breakdown, right? There's been, you know, breakdowns of technologies. There's been breakdown of, you know, network segmentation, everything we talked about from a tech standpoint, right? You know, so if I'm just making a connection between the two, you know, it's that. We're starting to see the breakdown actually get better and actually not taking place. But I can't tell you how amazing that song was. We saw one there. But
Well,
how about you?
Well, so I'm going to take the bonus question with the cover. You know, my thought is when they did the Queen and David Bowie Under Pressure, right? And the reason I like that is I always feel like in tech, you know, you talked about a rising tide lifts all boats. It's all about, you know, what's going on in the market, how the network is. And when Dave went and drummed and he sang the David Bowie portion and Taylor sang the Queen portion they played, I mean, it was unbelievable, right? And sometimes when we're talking to customers, we've got to be a little bit of an expert on things that that our friends in the business are, right? So, you know, I don't joke, you know, I do joke about it, but like, how do you know so much about Telemed? Well, my buddy Pete tells me all about it when we're talking to a customer, like, and you're like, yeah, you know, what about your security posture? What about networking? So I think, you know, sometimes to be great, you've got to know a lot of things within the business to make it happen, right?
Or know a resource who is your expert, right? So as a social studies teacher told me back in the day, you don't have to know everything. You just need to know where to go to get everything, right? So if you don't have an industry expert, which I'm glad we're friends, right? You're an industry expert in regards to the security and networking side. I'm not self-proclaiming. I know a lot about telehealth, but there's still room for me to grow every day in regards to what the health system is trying to do. So as long as we can rely on each other, I mean, we're all in this together, right? At the end of the day, we want to make sure that we're taking care of patients. That's us, right? We want to make sure our best foot forward, that we're helping our hospitals out to take care of us if something ever happens to you or me. So
yeah, I mean, so hey, I don't see any questions in the chat. Listen, we're going to wrap up here. Thanks for everybody joining the first installment of the Hammerdown Roadshow webinar series. You know, reach out directly to Pete or I if you'd like to have a deeper conversation, if you're evaluating technology or you just want to hear more of what we're talking about. I know Pete does a lot of sales calls and executive briefings. I do as well. You know, Troy Amon, our field CISO, you were talking about resources and adding clinical people. I've got Troy Amon on my team who he worked, you know, for a couple large providers for 20 plus years. And we, you know, very, very good relationship with a lot of the market, right? Jay Mervis at Fortinet.com, Pete Metzgar at Caregility.com. You can hit us on LinkedIn, direct message either of us. My next webinar will be on April 29th. We'll be discussing the EMR with Les Brown, the CTO at Self Regional. We've got a bunch of shows out in front of us. So if you want to know where we're going and what we're doing, I mean, we're going to, Peter, you guys going to Becker's in Chicago?
I believe we are going to Becker's in Chicago. Our next biggest show that we're going to is in May. We're going to ATA show in May. So reach out to us if you're traveling there. We'll have a nice booth set up, can go through some of these conversations we had today briefly. We'll have a team and staff there. So that's in Boston, I believe the first week in May.
Yeah.
So yeah,
okay.
thanks.
Awesome. So, hey, Pete, thanks for coming on and putting the hammer down.
Thank
talking
you.
Trends, tech, and tunes. Have a good weekend, everybody.